This conference will now be recorded.
So good morning, student. Okay. Good morning, student. So last time we discussed about the drowning and the types of drowning and different types of drowning and what are the causes for the death of the in case of the drowning. And finally we are discussing about the what are the post-mortem appearance in case of the drowning. Already we discussed about the. So what is the, just briefly, it is a form of asphyxial death where air entry into the lungs is prevented by the water or other fluids due to submersion of the mouth and nostril. So here whole body submersion is not necessary to cause the death in case of the drowning. So already we discussed about what is the mechanism and what are the types mechanism over, and we discussed about the types of drowning. So first type is the dry drowning, type 1, and wet drowning is the type 2. In wet drowning, there is a two types of freshwater drowning, the person who is drowned in the fresh water and the person who is drowned in the salt water, that's type 2b. And shallow water drowning, and where the mouth and the nostril is enough to cause the close of the nostrils to cause the drowning, and immersion syndrome and secondary drowning, isn't it? Immersion syndrome, otherwise called hydrocution, isn't it? So whenever a person jumps into the water, the epigastric area touched by the cold water may lead to the vagal inhibition. That is immersion syndrome. And the secondary drowning, where the person is retrieved or recovered from the uh, pond or in the water, and he may be survived, and he may be treated in the casualty. At the time of doing the treatment, the person may be died because of the complication of the drowning. That is the secondary drowning because of the pneumonitis కావచ్చు, any other causes, septicemia కావచ్చు, whatever it may be, you can call it as the secondary drowning. So this is the, now come to the what are the postmortem findings in case of the drowning. So external appearance, already we discussed it, that is the face is congested with cyanosis, occasionally petechial hemorrhages we can observe in this case of the drowning cases. So I have to remember that when the person, the dead body is recovered from the water means definitely the body will be cold. So immediately if you recover, the body will be definitely the cold. So total from top to bottom you have to observe for anything, any clues from the body dead body. So automatically you can observe the any weeds or grass or any mud, and you can collect from the dead body from the external appearance and the external observation. So the eye shows the subclavicular hemorrhage as it is the asphyxial deaths. You can observe the subclavicular hemorrhages and postmortem lividity, the chest, face, and the neck. You can observe. Why? Because the postmortem lividity or hypostasis will be developed, and that means dependent parts of the dead body. So here the body will be in the position. So the dependent parts are the chest, face, and neck. Like suppose for example, a postmortem lividity observed in case of the hanging, and the dependent parts like hands and legs. That is the stalking appearance. Right here, the postmortem lividity appear on the chest, face, and neck. So the characteristic froth already we discussed, that is a white, fine, leathery, tenacious, often tinged with blood, and when wiped away, it reappears gradually. So a number of cases, that in case of some other causes like organophosphate poisoning and opium poisoning and other causes, you can observe this froth. But in case of the characteristic froth, in case of the drowning, you can differentiate it from other causes. It is fine, white, fine, leathery, tenacious, and tinged with the blood. When wiped away, it reappears gradually. So if you just press over the chest, it can appear fastly. Why? Because the large amount of the froth appear in case of the drowning, especially salt water and this. Okay, the froth is characteristic anti-mortem external sign of the drowning. This is the one of the best sign of the external sign of the drowning. Right. See, this is a typical case of the drowning. Note the white leathery froth over the mouth, and also you note the retrieved rope along with the aquatic vegetation over the water. Aquatic vegetation, mud or wood or any particles from the water recovered. So PET Samsarina, already we discussed there is a goose skin or a goose flesh appearance. The puckered or granular appearance of the skin due to the contraction of the erector pile or muscles. The skin can be both antemortem or postmortem. That means a goose skin or a goose flesh appears both antemortem or postmortem. Suppose the person is died or murdered, and if you throw the body into the water, so after some time, maybe within 24 hours or 15 hours, the cutis ancillary will goose skin or goose flesh will be appeared. Simply this is because just the bottom puckered appearance because of the contrast of the rectal pile. So it was both in antemortem and postmortem they can observe. So Wasserman's own wrinkle or soden and bleached appearance of the palms and so you can see after ఎక్కువ time water కానీ so most of the time spend in the water automatically our legs in the feet will be pale. That is the wrinkled soden or bleached appearance of the palms and so we can observe within 24 hours of the body that is in the water. So you can consider the washerwoman's hands. That's why washerwomen are they spend more time in the water to cloth washing of the clothes. So it is looking like that. That's why we call it the washerwoman's hands. So next come to the gravel, mud, sand, weeds, or aquatic vegetation may be held in clenched due to the cadaveric spasm. It is one of the best antemortem proof of the drowning. So one is the fine froth, and second one is the gravel, mud, sands that is gripped by the that means person. Whatever the particles or sticks or woods or plants, whatever it may be in the ponds, he may be trying to grab it to save his life at the time of the drowning. So it may be the whatever the things that is present in the pond, they may be clenched in the hand of the person due to the cadaveric spasm. It is the last act by that person before going to die. So that is the cadaveric spasm. So the muscles of the hands may be active at the time of death because of the he will search for to hold anything to save his life. So it is one of the best sign of the antemortem proof of drowning in the body. So struggle of the victim for the life, you can observe this. Rigor usual appearance and other external injuries you can observe over the body. So in a jumbled water, so there is any rocks or any sharp objects in the water may cause the external injuries to the person. Now come to the what are the internal. So automatically after this we will open the internal structures, that means dead body. So first of all we will go through the thorax and abdomen. We will open the dead body. So what are the internal appearance of the, that means internal organs of the changes in the lungs. So a typical appearance in case of the asphyxial that you can observe, you have to write in the postmortem examination is the lungs. So you have to observe the lungs and you have to dissect the lungs, and you can whatever the observations you have to write in the postmortem examination, especially in case of the asphyxial death and drowning. So the lungs will be voluminous, greatly distended because of the water holding aspirated into the lungs. That is the voluminous and greatly distended, especially compared with the freshwater and saltwater drowning. In saltwater drowning, the lungs will be more voluminous compared with the freshwater. Definitely freshwater lo kuda lungs voluminous ఉంటుంది, but comparatively saltwater drowning, the volume is more extended. And the ballooning, we can see indentation of the ribs because of the increasing size of the lungs. They may cause the indentation by the ribs. So the congested lungs are pale gray appearance. You can observe the cardiac spots or none because of the asphyxial. So you have to write these things, especially in case of the asphyxial deaths. So ultrasound. Mottled appearance of the alternate red and gray, mostly over the interlobular septum on the anterior surface or margins of the lungs. So because of the forced expiration, the air throughout the to expel the water. It is the expiration during this drowning. So it may lead to the rupture of the alveoli and it can lead to the extravasation and formation of the pulmonary here. We can observe in this case of the drown. And distilled alveoli with the area of extravasation, you can observe on the section or we can see. Now come to the cut section of the lungs. So you have the serial cut section of the lungs and exudation of the watery frothy blood. The water mixed with the air and the blood. So mixed with this and form a frothy blood. So on cut section you can observe immediately exudation of the watery frothy blood. Characteristic picture of the lungs in the drowning is you can observe the emphysema exposure. Whenever the person is conscious, jump into the water, is conscious. That means antemortem. Conscious, the victim struggle to survive may form the emphysema exposure. At the same condition, you observe that this edema exposure. In this, the person will be unconscious or maybe dead body. So into the water, we can observe flooding of the lungs with more time. If you keep the body in the water, what happens automatically? Maybe sometime the body will be flooding of the lungs with the airless water. That is the unconscious phase. So you can call it the edema exposure. So emphysema exposure is the antemortem sign, but it is edema is the post-mortem sign or the person who is unconscious at the time of the into the water, fall into the water. Emphysema exposure and edema. Now what are the findings in larynx, trachea, and other respiratory signs? The presence of sand, mud, dirt, and aquatic vegetation at the level of the lower bronchial tree is important, and you can call it as the Mukherjee's gas lights. So lower bronchial tree, anything mud than well, definitely it is a sign of antemortem drowning. Next, the second one, that is a fine white blood tinged froth you can observe in total tract of the respiration, and the congestion you can observe, and the regurgitation of gastric contents may be seen in case of the drowning. So come to the, we can call it as the hydrostatic drowning events. Or these findings you can. Now come to the another important finding in case of the drowning is test for the chloride. So in generally, the chloride content of the chloride content is equal in the both right and the left chambers of the heart. That is 600 milligrams per the 100 ml. This is the chloride content of the blood. So left and right chambers are equal. That means 600 milligrams of the 100 ml. But in case the difference between the more than 25 milligrams per 100 ml, you can assess it as a drowning case. There is a difference between the left chamber and right chamber more than 25 milligrams per 100 ml. You can assess it as a drowning. You can call it as the Gettler's test. So Gettler's test is a 2 marks question. You have to remember Gettler's test. It is the essay question. Sorry, it is the entrance question. Gettler's test. And next come to the in freshwater drowning. What happens? The chloride content of the left heart is less than the right heart in freshwater, and in seawater chloride content of the left heart is more than the right heart in seawater. So remember, in the entrance question, the Gettler's test is very important. There is no difference in the chloride content in case of the. So definitely in drowning, there is a difference in the maintenance or drowning. But in some cases, exceptions, the chloride content will be no difference. What are the cause of that? In case of the laryngeal spasm or vagal inhibition, advanced putrefaction, and patent foramen problem, where the water will not enter into the body, sudden death will be occurred in this case. So, whether chloride content gives difference in the coach. That is it. This is the Gettler's test. You have to remember the 2 marks question, entrance question. Gettler's test. The chloride content of the blood in case of the drowning, isn't it? So next come to the intestine. The evidence of water swallowing, gravel, dirt, sand, aquatic vegetation shells will be present. So if you open the intestine, changes in the stomach and intestines, if you open the stomach, or the greater on the greater surface of the stomach. The evidence of water. Automatically, the person during the drowning aspirate the water as well as the ingestion of the water may be. So, along with the ingestion of the water, the gravel, that sand, whatever the present in the pond or in the water, that means river. So they will enter into the stomach. So if you open the intestine or stomach, you can see this. It is a positive sign of the antemortem problem. So definitely it is the antemortem sign, swallowing and inspiration. These are all the antemortem things. So presence of this gravels and that in the stomach, intestine, you can say it is a positive antemortem. Positive antemortem sign already we discussed, and this is also one of the pesticide. And cadaveric exposure, it is also positive sign of the drowning. So next come to the water that cannot enter into the stomach and intestine when the dead body is thrown into the water. So the person will be murdered and thrown into the water to make it as a drowning, to confuse the police people, investigation people. So what happens? The person will be murdered and thrown into the water. So, but definitely some people they may be feel that it is a drowning death, but it is a post-mortem. That means already murdered case thrown into the water, dead body. Because there is no live action or inspiration swallowing, but definitely the water cannot enter into the stomach and intestine, and the dead body is thrown into the water. And at the same time, you can see this is the water will not be entered. Already we discussed that it will not be entered in case of death due to the vagal inhibition, shock, or symptom, advanced infection, and the person unconscious before falling into the water. So in this case also, the gravel may be or dirt may be will not enter into the stomach. So that is the exceptions. Okay. Next come to the changes in the organs. The blood is watery, fluid and does not adhere to the hand, and because of dilution, hemodilution also. The blood is watery, fluid and does not adhere into the water. The chambers, left chamber usually empty and right chamber would be empty. Sorry, it is full. The brain, liver, spleen, kidney and extra, whatever the internal organs, other organs may be congested. And water inside the middle ear cavity, if found in this middle ear cavity, means it is the best antemortem sign of the drowning. This is the entrance question. So all of you mark it and you have to remember water inside the middle ear cavity, antemortem drowning. The one of the best sign. The entrance question already adhered. You have to remember water inside the middle ear cavity definitely is the antemortem sign of the drowning. Now from the another typical thing in case of drowning, diatoms. So diatoms are it is one of the best anti-mortem drowning, the dependable sign. So diatoms are unicellular algae in a silicon coating around it. Otherwise connected with the fresh fuel. Unicellular algae. Whenever the person fall into the water along with the water, dirt, mud, the algae that is present in that pond water or river water, they may enter into the body. See, automatically they will enter into the lungs and through the circulation, automatically they will be distributed to the total body. Total internal organs, they will be distributed through the blood circulation. So these are the unicellular algae. This is 4 marks question. A diatoms అనేది unicellular algae with inert silicon coating. They contain chlorophyll and diametamine, that is a brown pigment, and found in all natural water sources, especially in stagnant water like ponds. Over 15,000 species are found in the different types of the unicellular algae, that is diatoms found in the different ponds. So size of these 2 microns to 1 millimeter. Size of this algae will be there. The diatoms are 4 marks question. Remember, so unicellular algae with inert silicon coating and algae. These are the different types of the algae or diatoms present in the different types of the pond, especially stagnant water they will be present. And during the drowning, they also enter into the body, to the lungs, intestine, will be going to the other organs through the circulation. So they will be distributed. So that's why, in case of the drowning, they may take the bone marrow, when they will send to the forensic science lab, bone marrow especially, or other organs also you can send for the forensic science lab to detect the diatoms, isn't it? So you can compare diatoms present in that bond and the diatoms present in the dead body. You can connect the scene of crime. Definitely, the person presence of this type of the diatoms in the body and that point will be same. That means the person will be drowned in that particular point. They may connect the scene of crime. So diatoms. So these are the types of the diatoms you can observe. So what are the process of entering into the body by the diatoms? Water inhaled into the lungs during the drowning. Diatoms enter into the lungs, and diatoms penetrate the alveolar membrane and enter the bloodstream and heart through the heart circulation. They may be distributed to the brain, kidney, bone marrow, and liver. So you can take the specimen from the viscera, that means brain, kidney also. But in generally, we will take the bone marrow from the sternum for the detection of the diatoms. We will send to the circulation. And at the same time, you have to take the water from the that particular pond where the body is drawn for the comparison. Control for the control comparison, you have to take that water also. Now come to what are the methods of the demonstration of the diatoms in the lab. See, there is the methods of the first of all, they will digest the that means organ which have the content of the diatoms. So in case of the sulfuric acid and nitric acid, there will be acid digestion will be. After that, they will be take the whatever the stagnant, and they can have the direct microscopic exploration of the lung, and microscopic exploration of the tissue sections, and incineration in an electrical oven, and then dissolving the ashes in the nitric acid. Whatever it may be, these are the methods to demonstrate the diet. Acid digestion in the direct microscopic or microscopic observation. Is it? The procedure if you take, what is the procedure of the diatoms? Take 5 grams of the bone marrow or kidney, liver, brain tissue in the test tube. So whatever you collected from the body, viscera or bone marrow, take 5 grams and add 5 times the volume of the concentrated diet. So keep it for 2 days. This is the acid digestion method, where the acid digestion may occur for the 2 days. Next, centrifuge it. Discard the supernatant acid and take the depository. So centrifuge for the 2 days, acid digestion, and centrifuge it. Discard the supernatant acid and take the deposit of this content and examine under dark ground or the phase contact microscope for these algae. That means diatoms. So for the so you can observe under the microscope diatom, which type of the diatoms you can observe. So control, for the control, you have to take the 2 liters of water taken from the site of accident or for the company. Already discussed that means you have to take the water from that pond to compare this. Isn't it? The finding similar type of diatoms in the water sample in the body tissues is seen in favor of the drawing. That is, it connect the serum. So that is the atoms and importance of the diatom. Now come to the what is the medical legal significance of this drowning. So come to the medical legal significance, the forensic significance of the drowning. Why we are there studying about this drowning? So most of the times the chances of the suicide drowning in India are common, especially in females. So they will select the ponds for the suicide. The females usually dress completely, the males are scared. So in Indian the people will be scary, and that means they will feel that means whatever the comfort, and because of that the females will be completely dressed and the males will be scantily dressed, and adults drowned in the shallow water usually suicide unless proved otherwise. So shallow water, most of the times it is a suicide drowning. Most of the until otherwise it is flow. It is maybe preceded by the self-mutilating act. So suicidal drowning, not only suicidal hanging out, suicidal drowning out, suicidal whatever the suicidal. That means suicidal tendencies in definitely you can found the person self-mutilating attempt. Previously, attempt is on the hand. You can observe this wrist joint. You can observe it or any injuries over the throat. So previous attempts you can observe in suicidal cases, and you have to ask the relatives about his personality of the who the person died in the suicide. So if there is a suicidal tendency, that definitely you can take the information from the relatives or surrounding people. The person who has a suicidal tendency, definitely you can say it is a suicidal drown, the manner of death. But we will give the clue to the investigation people. We won't uh, confirm the death as a suicide homicide. Why? Because it is the manner that we end of the death will be decided by the police people, not by the forensic people, who will guide the person to decide whether it is a suicidal or a drowning. So we will give the clues to the thing. So the forensic people, we have to give the, first of all, it is the cause of death. Is it literal drowning or not? It is antemortem drowning or postmortem drowning, and what is the time since death? Manner of death will be decided by the police people only, and we have to guide them. Next, come to the accidental drowning. Hello. It is the commonest non-swimmers and children, drunkards, epileptics person. So non-swimmers, whenever fall into the water in floods, or maybe accidentally fall into the water, non-swimmers they automatically die because of the drowning. The children they can't swim, and drunkards, the ability person, they are unconscious or they are incapacitated person. They may fall into the water, they can't come up, and they will be dead in accident. And natural calamities like the floods also, you can see the accidental drowning. And the typical term respiratory labor, it is very important in gynecology and as well as in the forensic term respiratory. Whenever the person, the female is pregnant, newborn may accidentally drown inside the lavatory pan or compound. The pregnant, whenever go to the lavatory in a squatting position, when the person sitting in a squatting position, automatically the born the newborn baby, the baby will be dropped into the accidentally into the lavatory and may be drowned in the lavatory. It is an accidental drowning. It is most that is known as the precipitate labor. It is seen in case of the multipara woman, where the vaginal the roomy gland, vagina of the vaginal canal, it is roomy in case of the multipara woman. The person who gave to the multiple births, multipara woman seen in this the prostate labor. So now come to the homicide. It is uncommon. One of the method of choice in case of infants. So generally, if the person is adult, the capacity to resist the person. So homicide drowning is not possible. Uncommon. Another method is in case of infants, they are incapacitated person, so you can drown the person infants. Other marks of presumptive homicides may be seen on the over the struggle of them, and somewhat of a small injuries may be present to hold the baby to drown. Force into the water may be seen in case of the infant. Under intoxication, the person signs of struggle absent. A person who is under the influence of the alcohol or maybe in case of any other drugs, you can easily homicide that. You can kill the person by drowning. He is incapacitated person. A person may be incapacitated by the drowning. He may be dead. Homicide drowning is possible. So now we can see the typical case of the homicide drowning. The body was retrieved from the well, not both upper and lower limbs tied with a jute rope. See, he is a person, adult person, and he is a stout and he may be strong. It is very difficult to kill this person by the drowning. Why? Because the adult and is strong. So here what happens? if you hide the hands and legs, and if you throw into the water, whatever you can't swim, that's why the homicide drowning is possible. So the person will be retrieved from the body. You can observe both the hands and legs will be tied. So this is the typical example for this homicidal drowning. So with this, we finish this asphyxial deaths over asphyxial deaths. You remember this expected essay question from the asphyxial deaths will be there are injuries. Next time, asphyxial death or injuries. Chances are there. How to read thoroughly. We go through the textbooks and repeatedly how to read the asphyxial death. Isn't it? Okay. Thank you, all of you. You can disconnect from this. We will discuss the later next topic in the next class. Thank you.